What is dark chocolate? Chocolate is one of the few foods that taste awesome while providing significant health benefits. What is dark chocolate? Dark chocolate is produced by adding fat and sugar to cocoa. It differs from milk chocolate in that it contains little to no milk solids. It also goes by other common names, including bittersweet and semisweet chocolate. These differ slightly in sugar content, but can be used interchangeably in cooking and baking. Usually the simplest way to know if your chocolate is dark or not is to select one with a 70% or higher total cocoa content. Eating chocolate at least once a week is linked with a reduced risk of heart disease. This is according to a research published in the European Journal of Preventive Cardiology. Our study suggests that chocolate helps keep the heart's blood vessels healthy. In the past, studies have shown that chocolate is beneficial for both blood pressure and the lining of blood vessels. I wanted to see if it affects the blood vessels supplying the heart, the coronary arteries, or not. And if it does, is it beneficial or harmful? Compared with consuming chocolate less than once a week. Eating chocolate more than once a week was associated with an 8% decreased risk of coronary artery disease. Chocolate contains heart-healthy nutrients such as flavonoids, methylxanthines, polyphenols and stearic acid, which may reduce inflammation and increase good cholesterol, high-density lipoprotein or HDL cholesterol. Moderate amounts of chocolate seem to protect the coronary arteries, but it's likely that large quantities do not. The calories, sugar, milk, and fat in commercially available products need to be considered, particularly in diabetics and obese people. Cocoa has had a recorded role in medicine dating back well over 500 years. Over time, the impact of chocolate consumption on health has been the subject of various myths and numerous studies. Focus on the cardiovascular impact of chocolate has involved the effects of plant flavonols, such as those found in cocoa. Flavanol-rich cocoa ingestion has been found to induce substantial vasodilation. Studies investigating a potential protective effect of flavonols on cardiovascular disease, CVD, have found inverse associations. The more flavonols present, the less associated disease. Cocoa flavonols have been found to activate nitric oxide synthase in humans. Cocoa and chocolate have induced decreases in systolic and diastolic blood pressures in elderly patients with hypertension. In one study, cocoa intake was inversely related to blood pressure in a population of older men. A significant reduction in blood pressure has also been associated with the ingestion of chocolate in patients with high normal or mild hypertension. Cocoa and flavonols. However, the amount of cocoa and specifically, the amount of concentrated flavonols used in these research studies is at a much higher level than is available in commercial snacks. The concentration of flavanol in chocolate depends on the origin of the raw cocoa used in its production. The term dark chocolate is often inaccurate, as the color of the chocolate itself does not accurately reflect the flavanol content. Introducing alkali potash to cocoa nibs enhances the appearance and taste but reduces the amount of active flavanols. Alkalization produces a very dark chocolate that has virtually no flavanols. Milk chocolate has much lower flavanol content than does cocoa powder and dark chocolate. A study by Di Stefano found that eating dark chocolate that contains olive oil every day may improve endothelial function. The study found that middle-aged adults who ate a 40-gram bar of dark chocolate with extra virgin olive oil every day for a month had increased levels of endothelial progenitor cells. A study on patients with congestive heart failure found that flavanol-rich chocolate improves vascular function and inhibits platelet function. Recommendations suggest that chocolate should have at least 70% cocoa. Flavonoids help protect plants from environmental toxins and help repair damage. They can be found in a variety of foods, such as fruits and vegetables. When we eat foods rich in flavonoids, it appears that we also benefit from this antioxidant power. Antioxidants are believed to help the body's cells resist damage caused by free radicals. They are formed by normal bodily processes, such as breathing, and from environmental contaminants, like cigarette smoke. If your body does not have enough antioxidants to combat the amount of oxidation, it can become damaged by free radicals. An increase in oxidation can cause low-density lipoprotein, LDL, bad cholesterol, to form plaque on the artery walls. Flavonols are the main type of flavonoid found in cocoa and chocolate. In addition to antioxidant qualities, flavonols have other potential influences on vascular health, such as lowering blood pressure, improving blood flow to the brain and heart, making blood platelets less sticky and able to clot. 1. Dark chocolates may decrease inflammation. During times of stress, the body creates inflammation, which may cause or worsen heart disease. But dark chocolate stops this chain reaction, according to recent research. 2. Eating dark chocolate may lower your risk for a stroke. Stroke happens when a blood vessel carrying oxygen to the brain is blocked by a clot or bursts. 3. A Dutch study showed that just 2 to 6 ounces of cocoa per week lowered the risk of developing an irregular heartbeat by 20%. 4. Dark chocolate may improve cholesterol levels. In research published in 2005, people were given either dark chocolate or white chocolate to eat. Bad cholesterol. Those who got the dark chocolate lowered their bad LDL cholesterol, the type that clogs arteries and slows the flow of blood, by about 12%. 5. Dark chocolate may improve your circulation. When the flow of blood to arms and legs slows, it can become painful to walk. But eating 1.5 ounces of dark chocolate helped people with a condition that decreases blood flow to the legs to walk 15% longer and 11% farther than those who ate milk chocolate, according to a 2014 study. 6. Dark chocolate may lower blood pressure. High blood pressure is believed to be responsible for half of the world's cases of heart problems like heart attacks and strokes. But a little dark chocolate could keep your blood pressure in the healthy range. A review study looking at 35 previous studies found that regularly eating dark chocolate and cocoa products cause small but important decreases in blood pressure. 7. ORAC stands for oxygen radical absorbance capacity. It's a measure of the antioxidant activity of foods. Basically, researchers set a bunch of free radicals, bad, against a sample of a food. They see how well the antioxidants in the food can disarm the free radicals. It's worth mentioning that raw, unprocessed cocoa beans are among the highest scoring foods that have been tested. Dark chocolate is loaded with organic compounds that are biologically active and function as antioxidants. These include polyphenols, flavonols and catechins, among others. One study showed that cocoa and dark chocolate had more antioxidant activity, polyphenols, and flavonols than any other fruits tested, which included blueberries and acai berries. 8. Dark chocolates may protect your skin from the sun. The bioactive compounds in dark chocolate may also be great for your skin. The flavonols can protect against sun damage, improve blood flow to the skin, and increase skin density and hydration. The minimal erythemal dose, MED, is the minimum amount of UVB rays required to cause redness in the skin 24 hours after exposure. In one study of 30 people, the MED more than doubled after consuming dark chocolate high in flavonols for 12 weeks. If you're planning a beach vacation, consider enjoying some extra dark chocolate in the prior weeks and months. But check with your doctor or dermatologist before foregoing your normal skin care routine in favor of more dark chocolate. 9. Dark chocolates could improve brain function. The good news isn't over yet. Dark chocolate may also improve the function of your brain. One study of healthy volunteers showed that eating high flavonol cocoa for 5 days improved blood flow to the brain. Cocoa. Cocoa may also significantly improve cognitive function in older adults with mild cognitive impairment. It may improve verbal fluency and several risk factors for disease, as well. Additionally, cocoa contains stimulant substances like caffeine and theobromine, which may be a key reason why it can improve brain function in the short term. 10. Dark chocolate is very nutritious. If you buy quality dark chocolate with a high cocoa content, then it's quite nutritious. Quality dark chocolate is rich in fiber, iron, magnesium, copper, manganese, and a few other minerals. Ingredients to look for in a dark chocolate. It is best to choose dark chocolate made with as few ingredients as possible. The best dark chocolate always has chocolate liquor or cocoa listed as the first ingredient. There may be several forms of cocoa listed, such as cocoa powder, cocoa nibs and cocoa butter. All of these are acceptable additions to dark chocolate. Sometimes other ingredients are added to dark chocolate to improve its appearance, flavor and shelf life. Some of these ingredients are harmless, while others can have a negative impact on the overall quality of the chocolate. Sugar is often added to dark chocolate to balance its bitter taste. While sugar is an important component of dark chocolate, some brands go overboard. It is rare to find dark chocolate that doesn't have added sugar. A rule of thumb is to choose a brand that does not have sugar listed first on the ingredients list. Better yet, choose one that lists sugar last. Note that the higher the cocoa percentage, the lower the sugar content will be. Lecithin is an optional ingredient in dark chocolate. It's added to many store-bought chocolates as an emulsifier. It keeps the cocoa and cocoa butter from separating and helps blend flavors. It is commonly derived from soybeans, so you may see it listed as soy lecithin on the label. Soy lecithin is used in such small amounts in chocolate that it shouldn't pose any concerns about health effects or quality. When you're selecting a brand, keep in mind that lecithin isn't absolutely necessary to make chocolate. Milk. High-quality dark chocolate shouldn't have any milk added to it. The only exception would be milk fat. This is essentially butter that has had its moisture and non-fat solids removed. Chocolate makers sometimes add milk fat to dark chocolate to soften it and add flavor. Just like lecithin, milk fat is not required to make dark chocolate. Dark chocolate is often flavored with spices, extracts and oils to improve its taste. Flavors. The most common flavoring you will see in dark chocolate is vanilla. Unfortunately, it is difficult to differentiate on a food label which flavors are natural and which are artificial. If you want flavored dark chocolate, choose one that is organic. That way you can be sure the flavors are not artificial. If you come across dark chocolate that contains trans fat, avoid it. It is a significant risk factor for heart disease. Although less common to add trans fat to chocolate, manufacturers sometimes add it to improve shelf life and consistency. To make sure your chocolate doesn't include trans fat, check the ingredients list. If hydrogenated or partially hydrogenated oil is present, that means the bar contains trans fat. The healthiest dark chocolate contains a cocoa percentage of 70% or higher, which provides more antioxidants and health benefits. Avoid alkalized or Dutch dark chocolate. Dutching is a chocolate processing method that involves treatment with alkali, otherwise known as alkalization. This method is used to change the color of the chocolate and reduce the bitter flavor. Several studies have demonstrated that Dutching significantly reduces the amount of antioxidants in chocolate. For this reason, chocolate that has been Dutched should be avoided. To check whether chocolate has been Dutched, check the ingredients list for cocoa processed with alkali. Here are a few high-quality dark chocolate brands for you to check out. Alter Eco Chocolate is fair trade and organic. They have many types of dark chocolate bars to choose from. The richest chocolate you can get from them is their dark blackout bar, which is 85% cocoa. It only contains 6 grams of sugar and 4 ingredients: cacao beans, cocoa butter, raw cane sugar and vanilla beans. Pasha Chocolate makes chocolate in an allergen-free facility, so their products are free from common food allergens such as soy, dairy and wheat. They have a variety of dark chocolate bars that contain up to 85% cocoa. They take pride in using only essential ingredients to make their products, such as cocoa, sugar, vanilla and some fruit. Antidote Chocolate makes potent organic chocolate with ethically sourced cacao beans. Their bars are low in sugar and high in nutrients. All of their dark chocolate bars have a cocoa content of 70% or greater. They even have a bar that contains 100% raw cacao. Equal Exchange Chocolate is fair trade and organic, made with high-quality ingredients. They carry an extreme dark chocolate bar that is made from 4 ingredients, contains only 4 grams of sugar and has a cocoa percentage of 88%. There are many other manufacturers that produce excellent dark chocolate, including Lindt, Green and Blacks and others. The best dark chocolate has distinct characteristics, including the following: high in cocoa, 70% or higher cocoa percentage. Avoid dark chocolate that contains trans fat, milk, artificial flavorings, high amounts of sugar and other unnecessary ingredients. No alkali processing. Alkali processing is also known as Dutching. Avoid chocolate processed this way.